Hey, it's Dr. Modi from Gastro Office. Today I wanted to talk about probiotics and gut health. Now, I have a lot of patients who come to me and they're on a probiotic and they're having symptoms, whether it be bloating or diarrhea or pain, and they continue to take the probiotic. And my first question to everyone is, does it help, right? Are you finding benefit? And if the answer is no, then I would suggest that maybe we need to revisit the thought of gut health. Gut health, to me, doesn't mean that we just take a pill and everything gets fixed. It starts with what we put into our bodies and how we're emptying it, right? So it's the entire continuum. And for the most important question to ask is, what's your diet? Are you having a lot of processed foods? Do you have a dairy allergy? How about gluten? Do you have symptoms after eating bread and pastas? And then another area where we can dabble is complex sugars, which is a whole list of foods. But most importantly is what you're putting in your body. Do you feel good after meals? That's the ultimate question. For a lot of my patients, that answer is no. And so before we worry about spending money on a probiotic, I encourage patients to focus on their gut health with how they're cooking their meals, what they're putting into their bodies. Now, the second part of the equation is, well, okay, I've done that. I'm eating well, I'm exercising, I have a lot of good water intake, but I'm still having symptoms. So studies would suggest that, probiotics, there's only one that has been suggested in the literature and to help symptoms, especially in the irritable bowel patients. Now, for me, I would favor us, if you're not having symptom benefit with the probiotic, I would stop it. And I would consider alternative methods. One of those could be just a yogurt, right? Any yogurt can help reset some of the gut bacteria. Now, we have millions of bacteria in our GI tract, some good, some bad, but we need them all. And so yogurt can help reset that. And a lot of times what I've found is that after an illness or recent antibiotic use or travel, things can get changed in our systems. And so resetting that can be very important. And so probiotics aren't working, cut them out. If they're working for you, excellent, continue to take them because they probably are resetting some of that gut microbiome as well. But when it comes to your gut health, think about what you're putting in and how you're emptying, right? The last part of the equation. Are you constipated? Are you having diarrhea? Those are other things that definitely need to get teased out as well. Finally, I think it's important to remember that the American Gastro Association just came out with their own recommendations for healthy patients that have no other GI issues. There's no indication to take a probiotic